Hi, welcome to the Human Performance Laboratory at Springfield College. I want to thank you for participating in this study. I appreciate it very much. The information obtained from this study is really important to the trans community, so I'm really excited about it. This is going to be a familiarization video, just to tell you what to expect the day of data collection. We're going to go through everything briefly, just so you can see and get a sense. If you have any questions after watching the video, feel free to reach out to me. I'm happy to answer any questions that you may have. The overall purpose of this study is to create a physiological profile of the male to female trans individual in relationship to hormone levels and muscle performance. Sounds better in real life, I promise. So here we go. Thank you. All right, when you arrive to the Human Performance Laboratory, the first thing you're going to do is you're going to have a seat, and we're going to have about a 15-minute rest period. This is to get all your levels to baseline, hormones, and let you relax. During that time, I'm going to be giving you a clipboard with information for you to look over. You may have already filled these things out through email with me, but just if you haven't, you can do that now. That's going to include the informed consent to make sure that you understand what's going on, you sign approval. It's going to be a medical history questionnaire. It's going to be a physical activity questionnaire. And I think that's it. Also, I'm just going to make sure that you have satisfied everything that we need to. So in order to participate in this data collection session, it will have to be within 1 hour of your waking time. And you cannot have any food beforehand. Small sips of water are okay, but at the beginning, no food or water. So after the subject rests for 15 minutes, we're going to go ahead and do the blood prick to collect the hormone levels. The subject's going to rub their fingers together. We're going to use the non-dominant hand, middle or ring finger. All it is a slight pinprick. All we're going to do is milk the blood down and fill up each dot with a drop of blood. In some instances, it might be easier for the subject themselves, if they're comfortable, to milk the finger working down, and then they can feel their own pressure and be comfortable with placing the dots of blood into the circle. If needed, we can stop and move the fingers in a fist to promote blood flow. To fill out the 3 cards, it might be necessary to do another prick. Once all have been filled, we'll clean the area. Put a Band-Aid over it. And all the blood draws are done. Next is going to be measurement of body fat percentage. We're going to be using the bod pod right here behind me. In order to get into the bod pod for an accurate reading, there has to be appropriate clothing. So depending on your level of comfort, it could be a sports bra and spandex, could be a one-piece bathing suit, or just spandex shorts. That way no air can get underneath. Also, jewelry must be taken out, so my subject here would need to take out the nose ring and the earrings before the study. The subject will put on a beanie. This is a way to make sure the air doesn't get collected underneath the head. Pretty easy with how it goes. After some initial scale measurements, the subject's going to go into the bod pod. If at any point the subject feels uncomfortable, you can stop the test at any time. This will involve 3 30-second readings, and then you come out and you're done. Following the bod pod measurement, Every subject will get a chance to drink water since they haven't been drinking water the morning of. You can drink as much as you want of that 250 milliliters. Next is going to be our first strength measurement. We're going to be doing grip strength. Okay, using a simple dynamometer. You're going to hold it at your side. In a relaxed position, arm out to the side, just in here. You're going to get 2 practice squeezes to get familiar with the grip strength equipment. Following that, you're going to have 2 grips on either hand. So 2 grips on the dominant side and 2 grips on the non-dominant side. 30 seconds in between each grip. Following the grip strength, there'll be 1 minute of seated rest for the subject. Then we're going to move on to the vertical jump assessment on this mat. You'll get 2 practice jumps. The procedure is, as she's showing you, hands on the hips during the entire jump. You can bend down as far as you can, jump up as high as possible, and land. You'll get 2 practice jumps, and then 3 test jumps. In between each test jump will be 30 seconds rest. So after another minute seated rest, the next test is going to be a push-up test. For all subjects, we're going to have them in a modified position. One good way to get into that is to get into a high plank and then drop to the knees. So in this position, knees are on the ground, hands are underneath the shoulder. For this test, the subject is going to be asked to do the maximum number of push-ups they can do in 1 set. Subjects are encouraged to do as many as they possibly can before fatigue. Go ahead and give us an idea what it looks like. For each push-up, the chin must hit the mat. That's it. So the very last thing that subjects will take part in is what's called a peak VO2 test on the stationary bicycle. Between the last muscle push-up test, there'll be a 5-minute rest period where I will help situate the subject and fit them to the bike and to the mouthpiece. As you can see, it is a bit cumbersome, so it tends to feel awkward to people who have not done it before. However, you're going to be breathing normal air from the room that's channeled in through one tube, and then a separate tube collects your exhaled air that is analyzed by the computer. That's the information that we're going to use to get a sense of aerobic fitness. So it's perfectly safe, a little awkward at first, but I wouldn't be asking you to do anything that I wouldn't do myself or have done myself. Once everything is fit, including our subject's also going to have a heart rate monitor around the chest. After all that's fit, the subject will put the mouthpiece in their mouth. We also have to close off the nose, that way we can account for all the air. During the test, the subject's going to be biking. During the test, the subject's going to be biking in a graded protocol. There'll be a 3-minute warm-up, followed by 2-minute increments going higher and higher. I'm asking that subjects go as long as they can. The longest possible would be about 25 minutes. So it'll be after the 3-minute warm-up, you'll go through 2 minutes of increasingly more difficult pedaling, and you stop when you tell me that you can't go any longer. After that point, we will take the equipment off of you, and I will give you a big thank you for